I want you to take from our gathering today, you will have achieved a lot. And those 4 words are, we can do more. Yeah. Woo! We can do more. If you are a 69-year-old person and you had 5 coronaries, would you have the insurance to pay for your medical bills other than for an emergency room visit?
No.
No. If you were a former vice president, you would.
Right.
That thought should motivate all of you as you go out and do what David Boers will tell us to do at the end of these meetings when you call your representative or our state U.S. senators. This afternoon, this woman testified before a House subcommittee. Who is this woman? She is the head of WellPoint. And when asked why you were raising your rates in California by as much as 39%, she went to the left and to the right and to the middle saying it's the doctor's fault, it's the medical community's fault, it's the medical device company's fault. But never once did she say it's our fault. That's what we have to do. There's power to the people to say to those in Washington, enough is enough. The insurance companies have to take care of themselves, and if they don't do it, we are going to do it. Now, as evidence of that, the United States House of Representatives debated House Bill 4626 this afternoon. That bill is to lift the antitrust exemption that the insurance industry...
Oh, really? How about that? Long overdue.
And after 2 hours of debate, the U.S. House of Representatives, by a vote of over 400 for and only 19 against, passed that bill.
Oh!
I mentioned 4 words. We can do more. We can do more to improve competition. Competition is the word that captures what we need to keep our premiums lowered. The 2 best ways to do that are, as Andy has mentioned, the public option, which is still on the table, and it will remain on the table so long as each one of you and those that you deal with and contact and on whose computers, listservs you may be on, you communicate that thought, and it goes to Washington starting tonight and tomorrow and for the next day. You've got to do that. The second element of what we can do more is, again, ensure that the antitrust exemption that the insurance companies have enjoyed is put in a final bill. The House has passed it, now it's the Senate's turn. So the Senate has that as well as potentially the public option. Those 2 things we can do more. Next, effective dates. In President Obama's proposal and in the House and in the Senate versions, we hear of dates going to 2013, 2014, and even to 2020 to close the donut hole. Those dates are just too far out.
Right.
We must close them. To ensure that those dates come down to a very manageable year like 2010.
Yeah.
In President Obama's proposal, he has a health insurance rate authority to oversee the premium rates to be charged by insurance companies. It is a good start. It is a good thought. But even as in today, an analysis came out of that proposal, and I will quote a line from that analysis. As we can see by trends in the growth of healthcare premiums, such a regulatory approach is not the most effective way to bring down costs. We need a mechanism in place as soon as a bill is passed to put a lid on premium increases on an annual basis.
You're here.
Randy has mentioned the insurance reforms like no pre-existing condition will bar coverage or no caps on annual benefits, etc. In today's USA Today newspaper, the featured story on the front page had an admission by the insurance companies that will cause them to hike rates. So while the reforms are necessary, and there is no agreement, by the way, on them. In fact, in a paper that Andy and I put together that's out for distribution on the table, so if any of you who don't have it should pick it up. We crunched down about 2,000 pages into less than 2,500 words. But if in fact we have these reforms, and if they don't take effect for some period of time, we need an effective mechanism so that we aren't charged for those reforms. Keep that in mind. We cannot afford to charge the millions of Americans who don't have insurance because they can't afford it. So to say, well, we're going to give you these reforms, but by the way, we're going to have to charge you another $1,000 for them, doesn't do us any good. And when you call your representatives in either Senator Durbin or Senator Burris, you have to remind them of that. The insurance exchanges, which Andy mentioned, is a good idea, but it should be a national exchange, not
Agreed.
an exchange on a state-by-state basis.
Right.
If it is on a state-by-state basis, then insurers will go to the state which is most conducive
Least
to what
regulated.
they want as sellers of the product called health insurance.
Right.
That's why a national exchange is oh so important. The Republicans in their proposal that was put online on November 3rd of last year, in which they haven't varied, said that we should have the ability to purchase across state lines. Well, that would be fine for the insurance companies, because they'll go to the weakest state that provides the most effective state regulation for them, not for the consumers. Finally, a couple other points. One is Medicare discounts. The proposal by President Obama says that we'll close it all by 2020, excuse me. That's 10 years from now. That needs to be shortened up considerably, and we need to move on getting inexpensive pharmaceuticals for our nation's seniors.
Right.
Just everybody.
The final point is tort reform. Today, when the members of the House were debating the antitrust exemption, those in favor of it talked on the merits about eliminating this exemption. But those who opposed it, all they talked about was tort reform. They didn't care about the patients, they just cared about the companies they were trying to protect. And tort reform does not play into the equation at all. By having tort reform will not lower our health care costs. So again, I wrap up by saying, we can do more. We can do more. Thank you very much.
Thank you.